If you're thinking of doing some spring spruce up on your body, but you don't want to go under the knife for cosmetic surgery, there are now several non-invasive procedures available to you these days. Dermatologist Jeanine Downie is here to look at some of the newest options. Nice to have you back with us this morning, Doctor.
Thank you, Erica. Great to be back.
So the difference, just real quickly, between an invasive and a non-invasive is really the scalpel in many ways.
Right, exactly. And the invasive procedures tend to have much more downtime. They tend to be more costly. And because there's more downtime, there tend to potentially be more side effects.
Okay, so this is a little quicker.
It's quicker,
a little bit less
easier.
Expensive.
Yes, exactly.
Still, you know, shelling out some cash for this.
Right,
But
exactly.
So the first one you're going to show us is something called Exelis.
Right.
What does it do?
Okay, so Exelis means thin in Latin. It's fabulous. It's new radio frequency technology where we can actually tighten the skin and melt the fat. So I melted away saddlebags on myself that I've had for forever. And I was just like, you've got to be kidding me.
That before and after is amazing. The after is not retouched, right?
Right, no, the after is not retouched.
So it does more than just sort of firm up the underneath layer. It actually
tightens. Yeah, it actually tightens. So it's radio frequency. It actually, the heat goes down 2 centimeters into the deep dermis, and it actually, you know, causes a metabolic activity onset, which causes the fat cells to break apart. It goes into your lymphatics. You drink a ton of water, and you basically pee the fat out. It's completely safe.
Sounds good to me.
It's got no side effects. Good for all skin types. It's amazing. It's amazing technology. We're really excited.
So talk to us a little bit more as you show us. Joanne has graciously offered, where as we see how it works here. It's popular for stomach, also for chin, I understand, and for your arms. And this is for most women. No matter how much time you spend in the gym, it's really difficult in certain areas.
So it's targeted fat tissue lipolysis, which means the fat cells are breaking apart. It's unbelievable. So what this is great for people that, you know, are trying to exercise, but, you know, are not really getting anywhere with stubborn, resistant areas of fat. So saddlebags, the fat knee pads above the knees. Some of my patients are doing it for their ankles. You can actually do it on your face. You know, I mean, it's got a face piece on it too. You know, we're very excited.
And we see the chin there before and after. How much is this going to cost me?
Okay, so it's not going to be awful. It's going to wind up costing you about $500 per treatment session, so about $2,000 for the entire 4 treatment sessions. Some people need 6. It depends on the actual person.
So that's one option. Thank you very much. And as we move down here, this is something called Fraxel. This is actually a laser.
Right. Okay.
Which I've heard sort of in passing, but what does this do?
Okay, so Fraxel is like basically non-ablative. So that means it's not like the CO2 lasers where you would have downtime of a month or 2 months or potentially even longer. This is non-ablative. So what it does is it heats the tissue, and what we're showing here is what we can do with stretch marks, which there's unfortunately not a ton to be done with stretch marks at all. So it's kind of frustrating. And the bottom line is that this works very, very well for that purpose. So,
and this works well because it, just like the other treatment, it actually has to go fairly far under the skin. Is that right?
Exactly, exactly. So you're going to have to pick your little leg up a little bit, cutie. Yeah.
So you hit this with the laser. Do you feel that at all?
Yeah.
Is it like a heat or not really anything?
And it's a heat, and it actually contracts the tissue in, and it's safe and effective for all skin types. This is a Fraxel dual system, and it actually will collapse the stretch marks. Do we have the good before and after picture of the stretch marks? Yeah. Yeah.
We're working on them.
Okay, all right, so good.
Sorry, we both missed them because we were both focused on the laser. There we go again. So, and that is, you know, for anyone who has stretch marks, and a lot of women especially can relate to this after pregnancy, that is a really big difference. How much would this cost us?
Okay, so this is much more expensive. It varies on what section you're doing. Say you're just doing like kind of this area in your inner leg here. This would wind up being $750 per treatment session, and it would take like 6 of them. So this is a much more expensive machine.
You're saving up your tax return for that one.
It's saving up the tax return. You're too funny. Yeah, that's exactly right.
This next one does not involve a machine. What are we looking at here?
Okay, so this is a Vitalized Peel. This is resorcinol, lactic acid, and salicylic acid. And this is great for patients that want something done to spruce up their face. It's good for hyperpigmentation, people that have melasma. It's great for acne. It's great for, you know, just kind of trying to take some of the sun damage off the face. My patients love it. It's called the Vitalized Peel.
And we can see the before and after there. So
really impressive.
Really cuts down on some of the discoloration of the skin.
Right, exactly. And you need to do this in a system. So this is the pre-cleanse step. Excuse me, that's the prepping solution. This is a Vitalized Peel, and then that's the lactic acid afterwards. But this you do this in an office, not at home? You would do this in a doctor's office, absolutely not at home, and it works well for all skin types, and my patients absolutely love it. They're crazy about it.
Some great options for us. Dr. Downie, good to have you back with us this morning.
Good to be back. Thank you, Erica. Have a great day.